you started by doing some analysis around those call drivers and stuff like that. Can you talk to us a little bit about how you approached that kind of process of doing that initial analysis?
Right. So our call is a little different than any other industry, right? So we are in healthcare, so most of the calls will come related to medical-related information, scientific data-related, or the instrument, related information, right? They're asking. So it's not like as simple as what is my bank account or what is my bank, the balance and all that. So after analyzing all the data, we come up with a pattern. And that was a kind of, the moment where say like, okay, we have a very, the kind of pattern. We can see that in all this data, massive data, and I think it will be very easy for us now to train the bot based on this pattern, right? I mean, yeah, we can just identify some intent, and then based on those intent, the bot can be trained. So our whole data analysis team was involved. So basically, we spent a lot of time, because that time, 4 years back, also the data science was quite new, at least in my organization. So we spent a lot of time to doing some data analysis. We come up with some pattern, and based on that, we created those intents. So intent is just like the context, right? How do you identify the if you have a 10 question, out of 10 question might be you have a 2 intent, right? Because the same question can be asked in a different way, right? Because we are working in a multicultural environment. The same question in China and someone asking the same question in Japan could be very different way, but the answer could be the same. And that was the big challenge, because we are also dealing with a multilingual, the inquiry. So all this data analysis was done. I think that was a massive task we done, and then we come up with like, okay, now we know where is our gap, what's our needs, and then let's design our conversational AI. And that's where the workflow was started.